Do you have pain on this part of your wrist while typing? Or experience an uncomfortable clicking of wrist during certain movement? The pain may be worse during certain exercise such as yoga, or during a push-up. In some severe cases, the pain can be so irritable that simple day-to-day tasks such as lifting up a water bottle can be difficult. If you find yourself constantly struggling with pain over this side of the wrist, you could be having a common condition called ulnar carpal impaction. Ulnar carpal impaction syndrome is caused by the painful contact between the end of the ulnar bone and the carpal bone in the wrist. Certain wrist movement increases the pressure to this contact, making the pain worse, such as bending wrist backwards like doing a push-up, or moving the wrist sideways such as typing or using a mouse. Over time, this painful contact gradually wears out the joint, leading to arthritis. Occasionally, a heavy fall on the wrist can further damage the cartilage cushion called TFCC, causing painful clicking or locking. This keyhole examination of the wrist showed normal smooth cartilage on one side, but significant tear of the TFCC cartilage. Let's hear from this patient's experience who has struggled with his wrist for the last 5 years.
Anything like that, or lifting something, or twisting like that. Yep. I also found, I first noticed it because I wasn't able to bend my wrists back. If I was trying to do push-ups, any kind of exercise like that, it would hurt. And in fact, you know, any kind of exercise machine like a cross trainer where you're constantly moving the wrists makes it flare up.
Examination showed pain on outward deviation of the wrist and limitation of movement. There is also pain on inward deviation. The wrist is tender to touch, typically over these two areas around the bony lump on the back of the wrist. The patient's X-ray showed a narrow space between the ulna and the carpus. When the patient loads the wrist with a full grip, his X-ray confirms the impaction with bone-on-bone contact. The treatment options are listed here, from simple lifestyle changes to self-manage at home, to surgery in severe cases. When you have a flare-up, try some simple anti-inflammatories to reduce the irritation. Other ergonomic changes to your workstation may also reduce the stress on the wrist. Hand therapy, including exercise and wrist splint, is a good way to reduce pain and as prevention of further flare-up. The splint works by restricting certain wrist movement and prevent impaction. If your symptoms persist despite all other treatment, it may help to see a hand specialist. Sometimes a cortisone injection into the painful joint space can help reduce discomfort from weeks to months. Lastly, surgery is an effective treatment for this condition. It works by reducing the length of the ulnar bone so to create more joint space at the site of impaction. Plate and screws are fixed onto the ulna and a small segment of bone is removed. The cut surface is then compressed to achieve shortening of the ulna. This is often combined with a keyhole surgery of the wrist joint by removing some of the unstable tear of the TFCC. Following surgery, the wrist is protected in the cast for up to 6 weeks, but most patients can return back to desk job after a fortnight. I hope you find this video helpful. Please feel free to subscribe and leave comments.